And greatly, for me, an honor and the team along with me to welcome each one of you and to tell you about our story and our business. As I very quickly walk you through the slides, I take this opportunity to introduce myself and then my colleagues to introduce themselves to you. I am a medical doctor and I've had a long innings with Medi Assist. I have been with Medi Assist since 2006 in various capacities. In 2010-11, I led the management buyout in partnership with Bessemer Venture Partners, as the rest of it I shall share with you as we go along. In the past, as both a clinician and as an administrator of healthcare businesses, I've had the opportunity of working with Apollo Hospitals, with Reliance Health, and of course with Advent. With that, I hand over to our Chief Executive Officer, Satish Gidugu, to introduce himself.
Good afternoon. Thank you for being here. I'm Satish Gidugu. I'm the CEO at Medi Assist. Been with the company for a little over 10 years now. I come from a technology background, graduated from IIT Madras back in '98. Spent the first 15 years of my life mostly as a technologist, half of the time in startups. The last assignment of mine as a technologist was with a company called Redbus, where I was a CTO at Redbus, built a technology platform. And I actually joined Medi Assist in 2013 as a CTO. Spent a little bit of time building technology, then I moved onto the role of the Chief Operating Officer, played that role for a few years, and then took over as a CEO back in 2018. So that's my brief background.
Thank you, Satish. Matthew?
Thanks, sir. Good afternoon, everyone. Matthew George, CFO for the company. I've been with the company since March of 21. I've got over 28 years of professional experience in large listed corporations globally. So, I think thanks once again and welcome all.
Thank you, Matthew. So as we move along, I take this opportunity to introduce what a third-party administrator does and what Medi Assist does. Medi Assist is a very India-focused, India-centric business. We focus in partnering with payers or insurers in India. Today we work with 27 general and standalone health insurers in India. And we essentially administer the health insurance benefits that are sold under a policy. A policy could be to an institution, which is a group customer, or to a retail customer that buys a health insurance plan in India. We increasingly are also beginning to see work that we do with life insurers, and we today work with 4 life insurers in various capacities in helping them administer components of the health pieces that a life insurer sells under its life plans. Over the last year, we have also grown to work not only with Indian insurers, but with 4 global insurers. And this is really on account of our partnership with India, our partnership with employees or employers in India, and managing the global benefits for Indian employers that have an overseas workforce. The second arm of what we do in partnership with health insurance companies is that we build networks. Networks are typically and historically have been about hospitals. Today, we work with about 18,000 hospitals across the length and breadth of our country. This represents itself with about 1,069 towns and cities across India. And this is a network that is core or the backbone of our capabilities and our services that we deliver to each and every policyholder. As I mentioned, we also work with Indian companies and Indian insurers that have an overseas deployment of people, temporary or permanent. And this network today allows us to offer similar TPA services that we offer here in India to people across 141 countries around the world. Last of all, in partnership with payers or insurers and networks, we work with the individual policyholder in administering the policyholder benefits. Administering benefits essentially entails the idea that if anybody needed to access under a policy a healthcare benefit that is covered under the insurance policy, then that access is created by us. So we administer that access in what we call a cashless environment, where people actually can go into a hospital or into a doctor's office or into a pharmacy and then access or consume benefits in healthcare that they need at any given point in time. Today, from a membership perspective, we work with over 9,500 groups or employers in India, and this is numbers as of FY23. When it comes to claims, which is an integral part of the services that a TPA offers to the insurer and thereof to the policyholder, in the first half of 2023-24, we have managed over 3 million claims, 30 lakh claims in India today. As I move forward, I just would like to take this opportunity to introduce a little bit about what's happening in India. India is becoming an increasingly insured population. In FY23, about 16.5% of the population had some form of health insurance coverage or penetration. This is expected to double by FY28, with about 33.36% of the population that would get some form of health insurance plan that they would purchase. This essentially refers to strong tailwinds as insurance being an integral, or health insurance specifically, being an integral part of the Indian population, an integral part of any individual who needs to access healthcare. Two themes that are driving this penetration, while the CAGRs remain very high, is that India still continues, when even compared to some of the developing country peers, India still continues to be a very high participant, where people still spend a large part of their expenditure out of pocket. That means they don't have any insurance, health insurance cover to look after their expenditure. About half the expenditure in India today is when individuals pay out of pocket. The second theme is that while health insurance penetration is growing, the headwind relates to the fact that there is very high and runaway medical inflation. And you would have seen that across various platforms and forums, where medical inflation, or the cost of medical care, continues to remain a challenge. And I will, as we move along in the presentation, talk about our capabilities in managing these two themes in partnership with our insurers. While the complexity of health insurance is continuing to grow, and I would explain complexity to you, is that plans or health insurance policies are covering more and more elements of the healthcare expenditure as compared to 20 years ago, when it was typically only for when you fell seriously ill and needed to go into a hospital for hospitalization. Today, health insurance penetration is covering a vast spectrum of both inpatient hospital care, but also increasingly we see a large number of people opting in for the outpatient care programs. And this is truly, I would say, an important shift that's happening in our market, very similar to what's happened in many other geographies. But India, given the burden of cost of healthcare, is shifting to get a health insurance plan not only for the inpatient cost of care, but for the outpatient cost of care. As TPAs, today, TPAs are an integral part of the health insurance landscape in India. About 55% in FY22 of all premiums were administered by TPAs in partnership with general and standalone health insurers in India. It is expected that this number will continue to rise.